Steps in the delivery of the partial denture are presented in the slide. Although the number of patient appointments varies, from 5 to 7 is average, which includes the examination and follow-up appointments. Preliminary diagnostic impressions are made, usually with alginate. The partial denture is designed, suitable mouth preparations are performed, and a final impression is made for the master cast. A cast metal framework is fabricated to fit the master cast, a jaw relationship recorded, and a tooth shade is determined. Set the teeth, wax the soft tissue simulation, and try in the partial to verify the mounting and tooth shade. Process the partial denture, converting the wax simulation to PMMA. Deliver the partial denture, and perform follow-up care, preferably after 24 hours. It is important to instruct the patient in proper home care of the partial denture.
A diagnostic cast should be an accurate reproduction of all features that aid diagnosis. These casts supplement the oral examination, by permitting a view of the occlusion from the lingual as well as buccal, and permit viewing of occlusal relationships and the amount of space available for the prosthesis. The diagnostic cast may be surveyed to determine the influence of tooth contours, bony architecture, and the need for prosthetic surgery, among other things. The mounted casts may be used to present the case to the patient, to explain risks and benefits, and treatment alternatives. Casts may be used to fabricate individualized impression trays, when such conditions exist that preclude the use of the standard stock impression tray. Casts become part of the record of treatment. Alterations are frequently done on duplicate casts.
Partial denture designs are recorded on a design sheet. The design sheet contains illustrations of both arches. The design is drawn on the sheet, and the component specifications are then listed. These data may be transferred to the laboratory work authorization for fabrication of the framework. Areas to be contoured or modified generally consist of items not already specified.
RPD abutments usually require modification in order to provide a distinct path of insertion, suitable rest locations, favorable guide surfaces, and satisfactory retentive undercuts. These tooth modifications range from minor alteration of the tooth surface limited to enamel, to custom cast crowns.
It is helpful to visualize the RPD by drawing the design on the diagnostic cast. The following is a suggested order for drawing the components. First, determine which teeth will be used to support the RPD. Draw the appropriate rest seat locations. Next, outline minor connectors and proximal plates. Outline the major connector. Outline the base and base retentive elements. Determine how the partial is to be retained, and outline the clasps to be used. The retentive element may consist of cast metal, to be drawn in blue, or wrought wire, which is drawn in red. Reciprocal elements may consist of cast clasps, vertical bars, or plating and should be drawn in blue. When clasping, recall that buccal retention on one side of the arch is opposed by buccal retention on the opposite side. Similarly, lingual retention on one side is opposed by lingual on the opposite side. This further limits the path of dislodgement, and becomes increasingly important in partial dentures with extension bases.
The cast partial denture is a precision-made, rigid prosthesis and as such, should fit the mouth intimately. Teeth must be irreversibly recontoured to accept placement of the framework with the least amount of stress possible. Surveying the diagnostic cast is an essential part of planning these tooth alterations. Subsequently, surveying the master cast is important to verify that the tooth reduction has been adequately performed. Surveying is used to determine the most acceptable path of placement and removal. To identify proximal surfaces that are or can be made parallel to act as guide planes. To locate and measure areas that can be used for retention. To determine tooth, tissue, or bony interference. To determine most suitable path of placement to satisfy aesthetics. To permit accurate charting or delineation of mouth preparations to be made. To delineate height of contours. To record cast position in relation to the selected path of placement for future reference. The surveyor is a paralleling instrument that may be used to determine the relative parallelism of abutments. The survey line marked on the abutment tooth of the cast indicates the greatest circumference of that tooth in that horizontal plane. The greatest circumference of the crown of a tooth in a given horizontal plane is called the height of contour. Suprabulge. The portion of the crown of a tooth that is above the survey line. Infrabulge. The part of the crown of a tooth located below the survey line.
The contour of an object when a part of greater cross-sectional diameter overlies a part of lesser cross-sectional diameter is referred to as an undercut. Undercut is essential to retain the conventional partial denture. In other cases, undercut is excessive and must be eliminated by tooth preparation or blockout. A tool for the surveyor which is shaped so that it can be used to measure the amount of undercut on the abutment tooth in inches is called an undercut gauge. Your kit should contain 3 undercut gauges. The cast is analyzed with the surveyor to determine a most favorable path of placement. Initially the procedure is started with the occlusal plane perpendicular to the analyzing rod. If the partial denture can be inserted and removed from the mouth perpendicular to the patient occlusal plane, it is more convenient for the patient, and easier to prepare. Additional factors to consider are the amount of tooth structure to be removed. The most favorable path will result in a partial that minimizes tooth reduction, maximizes aesthetics and ease of placement. Factors to be explored while surveying are locations of guiding planes, areas of retention, interferences such as severely tipped teeth and bony projections, and aesthetics. The route traversed by a removable partial denture, as it is inserted and removed from the mouth, is known as the path of insertion. Tilt is the position of a cast on the surveyor table relative to the horizontal plane. Guide planes are the prepared axial surfaces of the teeth against which the removable partial denture glides, as it is inserted and removed from the mouth. Tripoding is referencing the position of the cast to the path of insertion. It is usually done in one of 2 ways, by marking the cast in 3 locations. This permits reorientation of the cast on the surveyor. Tripoding is necessary for the laboratory technician to fabricate your partial denture along the path you have established. In this lecture we have reviewed use of the diagnostic cast, design sheet, drawing the design, and surveying the cast.